Well, aged care patients in Victoria who need urgent medical care will soon be able to be treated from the comfort of their home rather than in an emergency department. An Australian-first virtual emergency department set up by doctors at one of Melbourne's busiest hospitals is helping to ease pressure on the health system.
This is the engine room of Victoria's virtual emergency department. It's healthcare reimagined thanks to COVID.
This is a one-of-a-kind model that's being delivered in Australia. It's an Australian first, if not in its current existence, potentially a world first.
The program was established in late 2020 by doctors at Melbourne's Northern Hospital. Hundreds of Victorians who call 000 every day are directed to the virtual ED instead of a real one if their situation is deemed non-life threatening.
We can make sure that when you come in, just like if you'd come into the emergency department, you can be seen by the healthcare professional that has the greatest expertise to see your problem and help you navigate your healthcare issues.
Sky News was given a first-hand look at the service in action. Here you can see Nurse Belinda holding a consultation with mother Lisa Cusack. She's worried about her 3-year-old son Lachlan's rising fever.
I'll just go through a brief explanation of what we do. So we will do an assessment on Lachlan.
He's been vomiting a lot, but he's not had any fluids or food for over 24 hours, and his temp just keeps spiking.
Unlike telehealth, video is mandated and translators are on hand to help.
Yeah, we've been getting really good feedback. It's so accessible, and having those experienced clinicians, nurses, nurse practitioners and emergency doctors to assist with these, and it's so accessible.
The program is designed to take pressure off paramedics and emergency departments. From April to June this year, the number of patients forced to wait in EDs for more than 24 hours was 4 times higher than the same period in 2021. Since January, Ambulance Victoria has enacted 7 code reds, calling in off-duty staff to deal with an increase in demand because of Omicron and the flu. More than 20 Victorians have died waiting for an ambulance.
Victoria's health system is crumbling. People are dying. They're not getting an ambulance. They can't get through to 000. They are dying.
The VVED has begun working with aged care patients to free up even more hospital beds.
From the emergency department's perspective, there's pressure to get those patients into beds, but often they are the patients that stay the longest because they have the most complex issues to deal with.
The program's also tackling workforce shortages by allowing staff to work remotely.
We have staff that had previously left because they were burnt out coming back into the workforce. So I think we are learning a lot about virtual care models, not only for the benefits for patients, but also the benefits to healthcare professionals.
Victoria's government has announced it'll fund a major expansion of this service, allowing healthcare professionals to treat 600 patients per day by the end of October.
To go from about 300 patients per day, it'll go to 600 and ultimately push beyond 700 early next year.
The doubling of capacity comes ahead of the November state election, where health will be a major battleground. Julia Bradley, Sky News, Melbourne.